Our next speaker is Dr. Adam Davis. Dr. Davis is from Jefferson, Ohio, so he's a local to us. He earned his Bachelor's of Science in Biology or Pre-Med from Youngstown State University and his Doctorate of Chiropractic Medicine from New York Chiropractic College in 2006. Dr. Davis has postdoctoral diploma degrees in Applied Kinesiology, Clinical Nutrition, and Acupuncture. Dr. Davis has lectured on various health topics nationally. He believes that any symptom, disease, or condition has an underlying nutritional aspect that must be addressed and corrected in order to be healthy. With a proactive approach, he corrects imbalances and helps to make positive lifestyle changes to prevent disease. Today, I've asked him to come and share with us how nutrition affects us when we're fighting chronic illness. Dr. Davis.
All right, thank you very much. Thank you guys for being here today. A wonderful day for education. A lot of great speakers here, so I appreciate the opportunity to come out and educate. So, I am local, born and raised in Jefferson, so I do appreciate being able to work with people in our community here to try to help them achieve a higher, greater level of health. If you've ever been in my office, I have a quote on the wall that says, "The best doctors give the least medicine," which I think that that's really important in health in general, because I think there's a big misunderstanding that if we take medicine, then that makes us healthy. Which, when you really break it down and think about it, it's kind of the opposite, because if you need a medication, it means you're not healthy, okay? But in this instance, with Lyme disease, antibiotics are used a lot, with great benefit. I've heard a lot of stories from different people throughout the day who've had benefits using antibiotics and who have not had benefits using antibiotics. But one of the things that I can tell you, and where I pride myself, is trying to get the body as healthy as possible, get the immune system as healthy as possible, get the nervous system as healthy as possible, so we have the nuts and bolts needed to fight Lyme's. Now, sitting out in the crowd today, I feel that there's a lot of frustration out there, and rightfully so. It sounds like it's hard to get answers, even from physicians, okay? And like Dr. Curry was saying, I always tell my patients this: listen, you guys hired us to work for you. Okay, so if you have a physician that isn't up to your expectations, answering your questions, doing what you want them to, then you fire them, you find somebody else that's willing to work with you, do what you want to do. Okay, so just remember, you're always in control. Okay, we're here to guide you. Okay, we're here for advice, okay, and recommendations, but I haven't developed the ability of X-ray vision yet. Okay, yet. I'm working on it though. Okay, so if a doctor says, well, I don't think you have that, you gotta be proactive and say, prove me wrong then. Do the test that I want you to do, and prove otherwise that I don't have Lyme disease, because until you rule that out, it's on the table. Okay, and I want everybody to understand that, because misdiagnosis of migraines, fibromyalgia, chronic disease, eczema, psoriasis, lethargy, fatigue, sleep problems, sleep disorders, that sort of thing, all could be Lyme's disease. Now, you might be taking 25 different medications for all these symptoms, but really the underlying cause is this damn Lyme's that everyone's dealing with. Okay, and it is. It's becoming crazy. Now, one of the aspects I look at is neurology. I actually have practice functional neurology, so I go through and do my neurologic test, because I find that, the nervous system is greatly affected through Lyme's. Okay, people get that Lyme's brain. So you have the depression, you have just the mental fatigue, the brain fog. So all that really needs to be addressed wholeheartedly, along with the immune system, along with the herbs and that sort of thing, to get a resolution of Lyme's, because it's really hard to beat when people come in and they have a slew of test results that have been run and they have Lyme's disease. I just sit there and shake my head, man. It's not easy. It's not easy for you guys. It's not easy for the doctors. Not easy for the patients. But one thing I do want to say is I just want everyone to say thank you to the caretakers out there, the people that are suffering from Lyme's, because it's not just about the patient, it's about the whole family. Because Lyme's can be life-changing. It can, one day you're out there, playing baseball and everything is good, and you're out with your buddies in the woods, you get bit by a tick, and your life is forever changed. Okay, so locally here, I try to help people pick up the pieces, okay, and try to get their lives back, because I know they don't want to be in my office getting treatment, and I want them to be out there having fun and feeling good from my treatment. Okay, that's what's important to me. Okay, that's what I do, is try to help bring you and your family to a higher level of health. Okay, so that's what I enjoy about my job in working with patients that have Lyme disease. Now, the body is very much like a car. Okay, it's a vehicle. All right, the brain is like the supercomputer. That's your onboard computer. Tells you where to drive. You can talk to your car nowadays. Okay, the brain's the same way. The gas and that sort of thing, the oil, okay, is what we use nutrition for. Okay, that's what makes our car run better. That's what makes our bodies run better. So we really need to look at our nutrition and only putting good, healthy things into our body. Now, being a chiropractor, the neat thing about this situation is I'm not even licensed to treat infections. It's not within my scope of practice. All right, so to be up here to talk to you guys about treating infections naturally, that's a great honor to me. Okay, because technically that's out of my scope of practice. All right, but it's important that you co-treat using alternative medicine and regular medicine in order to achieve the best outcome. All right, I do work with several doctors, who co-treat Lyme's patients, because you look at the studies and that seems to be what works the best. Okay, so we do have that interaction, and that's what's important, to get the patients to the highest level of health possible. Now, the way I approach health is an aspect called the triad of health, okay, much like a triangle, all right? One aspect is structural, okay, that's benefits such as chiropractic therapy, acupuncture, and massage therapy, that sort of things. There's an emotional aspect of the triad of health, which if you are part of a Lyme's family, you understand that there's a lot of emotional issues that goes in with chronic illness and chronic disease. And then the other aspect is biochemistry. All right, the chemistry, that is what I'm going to talk about today, as far as if you have a vitamin deficiency, a mineral deficiency, essential fatty acid deficiency, there is no medication out there that's going to fix that deficiency, because it's a nutrient deficiency. Okay, there's no such thing as a Advil deficiency or an antibiotic deficiency. It doesn't exist. Okay, but you can get stuff like chronic fatigue, depression, because of vitamin D deficiency, which is rapid around here. Everyone has vitamin D deficiency because we don't get enough sunlight. Exactly. That's where we get all of our vitamin D. So a lot of my Lyme patients and chronic fatigue patients, as people in general that come in, often have a low vitamin D. Now, vitamin D, normal range starts at 30 and up to about 80. But that's not an optimal range. We always shoot for optimal ranges when I do treatment with patients. Optimal range is around 60 to 70. All right, so if we get our body into optimal ranges of nutrients, it's going to work better. Some of my patients come in and they're like, oh, my vitamin D is good, it's at 31. And I'm like, that's not good enough. Then I go through and I do my exam on them, they got all these sore spots. Then I can give them some vitamin D and all those sore spots go away, and you can say, hey, your vitamin D isn't good enough, let's get it up to about 60 or 70. All right, remember, sunburns are bad, suntans are good. Okay, so make sure you get out in the sun. All right, so just one of the reasons that we can chronically be sick, take as much medication as possible, and still not really get better, because we're not addressing the underlying causes of the disease. Does everybody understand that? All right, it's very important to take your vitamins and know where your deficiencies are. If you don't know, that's what we do in my office. We test that, figure it out, get your body working right. Now, the question is, why is nutrition important? I'm just going to give you a personal experience. Now, I'm a chiropractor by trade, and I got into chiropractic because I hurt my back skateboarding when I was about 13. I was walking around all crooked, had a lot of pain. After a couple weeks, my parents were like, "You're still in that much pain?" Yeah, I never felt right since that skateboarding incident. They're like, "Well, we're gonna take you to the chiropractor," which scared the hell out of me because I didn't know what a chiropractor was. So my dad made it real simple. He was like, "Well, he's gonna put his hands on you and make you feel better." Which, hey, that sounded perfect. You know, being a young kid, I don't want a shot. You know, I don't want to have to take medicine. So I went and I got adjusted, and I felt better for about a day. And I went back and got adjusted again, and I felt better for about a day. And I thought, am I gonna have to do this every other day for the rest of my life to feel better? Well, I ended up going to a different chiropractor. This guy specialized in a technique called applied kinesiology, which basically it's functional neurology. There's muscle testing involved, reflexology involved, but it's all governed by the nervous system. After his exam and treatment on me, I felt a million times better. The pain went away, and it had never come back. So going into chiropractic school, I knew I wanted to be an applied kinesiologist. I'm very honored to be an applied kinesiologist. Now, around when I was about 15, I started developing this back pain that would get worse as the day went on, and to the point where I could barely move. I was, at the end of the day, you know, I was kind of crawling around. And I had, you know, I was doing lawn care and landscaping. I was a college kid. Eventually, and I dealt with this back pain over and over. No matter how many times I got it adjusted, no matter if I got acupuncture, no matter if I got what, the back pain wouldn't go away. Finally, one day, after exercise would make it worse. I can't do physical therapy, and well, get a CT scan. Got a CT scan, nothing. Well, you're gonna have to go see pain management if this doesn't clear up. Pain management? I'm a young kid. I'm gonna have to manage my pain with injections for the rest of my life. Medication's not working. What the heck am I supposed to do? Well, then one day I realized, you know, maybe I'm not drinking enough water. And then I thought, could water really cause that much issues with me? I mean, we're talking about water. Could I have a water deficiency? It's called dehydration, right? Well, knowing applied kinesiology, the kidneys are associated with a muscle called your psoas, which makes you walk. Okay, so as I would walk throughout the day, that muscle wasn't working, and I was getting more dehydrated, and my back would start locking up to the point where I could barely move. So once I started drinking lots of water every day, guess what? My back pain resolved. Never came back. Huh. So you're telling me you can fix pain just by drinking water? Boy, that sounds like a cheap and easy thing. So, learning acupuncture and learning reflexology, I just want to do just a little test, and I'm not sure how this is going to go because I like to shoot from the hip. But there's an acupuncture point on the inside of your ankle, just above your bone. I want all you guys to rub. It's about 2 to 3 inches just above the inside part of your ankle. It's about a quarter spot. And I want, if it's sore or tender, rub it on each side. If it's sore or tender, I want you to raise your hand. And you've got a sore or tender spot like a bruise. Almost feels like a bruise, right? Okay, you see some hands up there? Okay, we're going to do a quick experiment. Keep your hands up, and I'm going to, if you guys have water, I want you to open your water bottles. If you don't have water, we're going to pass out some water to you. We're going to see how this works. I know this sounds crazy. I've been called a witch doctor before, which I kind of enjoy because it's different than anything else that you guys probably ever experienced, okay? So what I want you to do, if you did have a sore spot, I want you to drink the bottle of water as much as you can. The last little bit, leave in your mouth. Okay, so drink the water. Drink as much water as you can. I don't want you to get yourself sick, but you know, enjoy the water. Kind of swish it around. Okay, and the last little bit, just keep in your mouth. All right. Okay. Now, what I want you to do is rub that same spot. And if the soreness, that bruised feeling, has reduced or went away, I want you to raise your hand again. We got some hands going up, right? I think that's kind of incredible, to be able to reduce pain in the body just like that using water. So what I want to explain to you is how important nutrition is. All right, if you have that spot and it went away by drinking water, you are dehydrated. You need to drink more water every day. If you don't, you're going to develop stuff like back pain, hip pain, that's going to turn into a degenerative condition. Your hip's going to wear out quicker. Your back's going to wear out quicker. You ever wonder why you get a degenerative condition only on one side of your body? Sometimes. Why did my right knee go bad and not my left knee? Why did my right hip go bad? And I mean, right, you take the same amount of steps, more or less, right, every day. Why does one side wear out faster than the other? It can be stuff like a nutritional deficiency that wasn't addressed that makes the body wear out over time. It can be chronic dehydration. Chronic dehydration. Our cartilage, the discs in our back, the discs in our knee, they need to be hydrated. They're like sponges. So if we have chronic dehydration, you drink too much coffee, drink too much soda, drink too much tea, alcohol, all that stuff is dehydrating, okay? That makes our body wear out quicker. So stay hydrated, okay? It's very important, but it's amazing that we can take pain away just like that by doing something as simple as drinking water. So that is, I just want to make a point that that's how important nutrition is, okay? So when it comes to stuff like Lyme disease, one buzzword that I hadn't heard any of the physicians talk about so far is biofilms. Has anybody ever heard the term biofilms? Got a couple, okay, more than a couple. All right, good. Biofilms, if you're not familiar with it, is what makes Lyme disease so hard to beat. Okay, Lyme's is very good at protecting itself. A biofilm is something that the disease, that it presses out and basically builds a wall, okay, like a shield around it. Okay, and that's why it's so hard for the antibiotics to penetrate those biofilms. And that's why it's hard. Sometimes antibiotics work, sometimes it doesn't work, sometimes it only gets half of it, and then you get a reinfection. So one of the things that I do in my office, it's a group of essential oils. It's called BFB1 and 2. That stands for Biofilm Buster. Okay, it's an oil that I use with my patients to degrade those biofilms. That way the antibiotics or herbs, stuff like oregano oil, works well at defeating the Lymes because we've degraded those biofilms. So with my treatments, I always insist that patients use the biofilm buster in order to degrade the biofilms so it's more effective when we use the antibiotics or other herbs. Okay, so that's really important. So if you've never heard of biofilms, do some research because that is one of the things that protects its Lymes. That's why it's so hard to defeat Lymes, okay, because we got to degrade those. All right, so that's really important, something I want you guys to take away from that. Now, we all know sugar's bad, and I'm sure a lot of the stuff that I'm going to tell you today, you're like, oh yeah, I knew that. I deal with a lot of people. I do weight loss. It's a huge thing in our area, in my practice, huge part of my practice, and the majority of people know what they're supposed to do. It's a matter of getting them to do it. If I were to ask you guys, who here thinks soda pop is healthy? All right, so we have an educated group. I like that. Next question, how many people here drink soda pop? Yeah, exactly, okay, right. So we know it's not good for us, we know sugar's not good for us, yet we still do it. So half of the battle is making the conscious effort to be healthy. Working with patients, they're always like, well, what am I supposed to eat when I go out for a meal or something? Look at a menu this way. Don't look at it like, what do I want to eat? Look at it like, what am I allowed to have? I think that's really important because if you look at it that way, you're only going to be putting healthy stuff into your body. And at the end of the day, if you're out at the beach, you're sitting out there with your six-pack hanging out, you're not going to worry about that pizza that you didn't eat, or you're not going to be worrying about the hamburger that you skipped. Okay, it just doesn't work like that. All right, so got to make a conscious effort. Now we know sugar runs infections. It drives infections, it drives cancer, it drives inflammation. Inflammation is the bottom underlying cause of disease, whether it be brain disease, joint disease, okay, intestinal diseases, anything like that. It's all driven through inflammation. So one of the things we need to do is keep our inflammation as low as possible. We can do that through food avoidance, stuff like sugars, and stuff that break down into sugar. Breads, pasta, rice, potatoes, corn, alcohol. All that stuff turns into sugar when we eat it. Okay, so those are food groups that we want to avoid. Now, if we're exercising and burning that a little bit more, you know, you can have a little bit more lenience. All right, so along with sugar, there's also foods like wheat. Okay, there's gluten. You guys heard of gluten sensitivities and gluten allergies, dairy allergies, okay, corn allergies. These things are very prevalent. And it's really important to avoid your food sensitivities because it's going to drive the inflammation. Your immune system is going to concentrate on that and not going to concentrate on fighting Lyme's. So a lot of my patients who have Lyme's, we have to put them on a real restrictive diet. Okay, it's one of the first things that we need to do in order to get your immune system where it needs to be capable of fighting disease. Now, if you're out there and your head's kind of dropping a little bit and your eyes are closing a little bit, you probably ate too much bread at lunch. That's what happens. We eat too much bread, and all of a sudden we get, it's called reactive hypoglycemia. We get sleepy all of a sudden. All right, so if you notice yourself falling asleep, you probably ate too much sugar. If you notice yourself kind of getting a stuffy nose, or you have to blow your nose while you're eating, you have a sensitivity to whatever it is you're eating. Okay, so if you ever have to stop and blow your nose in the middle of the food, think, what am I eating here? Is it dairy? Is it gluten? Okay, so pay attention to your body is the underlying theme. All right, you got to get your body healthy in order to win. That's super important as far as the fundamentals of health. The biggest thing as far as food avoidance that I've seen in my practice, we can take care of stuff like ADD, ADHD. I've had parents come in that they don't want their kid medicated, but the kid is doing bad in school, is running around all the time. He can't even sit at the dinner table to eat. So go through and do some testing on him and find out that, well, they got a gluten sensitivity. Let's remove gluten from their diet and see how they do. Well, God forbid, they come back in a month or two and they're like, oh my God, it's like I got a new kid. This is so amazing. He'll sit there and at the dinner table and eat his gluten-free meal, and he's like a normal kid. That's like giving your life back, getting your life back. You know, like all of a sudden I had this kid who wasn't doing good in school, and all you had to do was just clean up his diet, not medicate him, because medicating him is not going to fix the sensitivity, the food sensitivity that's driving his nervous system to cause this ADD, ADHD. So food avoidance is super important. Now the other aspect of inflammation is anti-inflammation. Okay, stuff like fish oils, okay, essential fatty acids. Fish oils are really good at decreasing inflammation. Stuff like vitamin C and antioxidants, that's really good at helping reduce risks of cancer, Alzheimer's, dementia, anything like that. So we want to make sure we're eating our fruits and vegetables, avoiding our starchy carbohydrates, and then eating clean sources of protein, like freshwater fish, that has tons of healthy fatty acids in it. So make sure that you eat a clean diet, okay? Pay attention to how you feel after you eat. A lot of times I just have patients eat a single food item to see how they feel. I want you to sit down and eat a thing of cheese and drink a glass of milk and tell me how you feel. Well, I don't know, I was all bloated, you know, my nose got all stuffed up. Yeah, you probably got a dairy sensitivity. We don't have to run expensive tests. We can just have you test yourself. Same thing with gluten. Just sit down and eat half a loaf of bread. And if your stomach hurts, you know, the next thing you know, your next day you're getting pimples, you're getting a rash. That's where you're like, I don't know, my skin's all goofy after I did that. Yeah, but you got a sensitivity to gluten. Okay? The biggest thing people are like, well, I don't know about gluten sensitivity. I don't believe in gluten sensitivity. Well, sometimes it's not the actual wheat that causes the issue. Sometimes it's the genetically modified wheat seed, okay, that causes it. People are like, what's genetically modified? Well, they take Roundup and inject it into the seed, and they plant it, and it grows, and then it gets into your bread, and you eat it, and that's Roundup that you're eating. You ever seen these pictures of the guys walking through the wheat fields in hazmat suits? You think that's healthy? You want to eat that? Absolutely not. Okay, that's what destroys your intestine and then gives you a food sensitivity to wheat. They say, well, when I go over to Italy, I've ate bread and pizza over there and I didn't have a reaction. That's because they don't do that over there. I have a patient, one of my patients are from Russia, and he said that, you know, we don't have any organic food in Russia. I said, you guys don't have any organic food? That's crazy. That's the biggest thing we have here. It's huge. He said, yeah, because all the food's organic. I'm like, that makes total sense. Yeah, of course not. And it's one of the things he said. He's like, the thing I miss about being over there is how good the food tastes compared to here. Which I was like, I've never been to Russia. I've never really been, outside of the US, so I was not aware of that. So let's see, Lauren, we only got a couple minutes left. But I just want to wrap up by saying, we need to protect ourselves against Lyme's. So increasing a lot of garlic in your diet is good. I mean, you might not have a lot of friends if you increase a lot of garlic, but you're not going to get bit by Lyme's. It's really going to reduce the risk because they don't like, herbs. That's one of the things that they don't like, So you want to increase that. Stuff like possums, they love eating ticks, okay? So don't shoo the possum away. Put some garbage out behind your house, all right? Let them come because they're going to eat ticks. Same thing like guinea hens. Okay, these birds, they just love eating ticks. Okay, so stuff like that, you kind of laugh, but it's serious. It's something that we can do to avoid getting bit and that sort of thing. So, probiotics versus antibiotics. So, the last thing I want to talk to you about, right? So gotta take probiotics, keep a healthy gut. One of the things that I've learned is if you're taking a probiotic, you want to take an antibiotic and probiotic away from each other. Okay, sometimes people are like, well, I gotta take the probiotic. I'm like, okay, well, if you do, at least keep it 12 hours or so away from your antibiotic. Okay, but most of the time I say, finish your antibiotic, okay, clear out all the bad stuff, and it carpet bombs everything. It just doesn't kill the bad guys, it kills the good guys too. So you need to re-inoculate with probiotics. But take all the antibiotics, kill the bugs, and then re-inoculate with probiotics, okay? It's very important. Now, I can't say I'm the smartest guy in this group by any means, and I'm not even a Lyme's expert, but I am a health expert, okay? And I've studied under all the greatest health experts in the world. If they had a book, I read it. If they had a video series, I watched it. I got a lot of different degrees, and I got more initials after my name than I actually have in my name, okay? Which is kind of funny because no matter how many degrees I get, my wife still thinks I'm a dumbass. So, take it for what that's worth. But I'm here to help is the bottom line, okay? I'm right here in Jefferson. My office manager makes fun of me because she's like, we got like a Cadillac dealership or Ferrari dealership in Amish country. Okay, she's like, you got all this state-of-the-art equipment and all this stuff that you can help all these people, and they don't really know about it. So I'm so excited to be here to let you guys know that I'm right in Jefferson, and I'm a valuable ally in your guys' fight against Lyme disease. So I just want to thank you guys for giving me the time to come out and give you a little insight on how important nutrition is, and we're here for you. So if you guys have any questions or anything, let us know. I do have a greens product, okay, that I want to make sure everybody gets. It's super healthy. It's full of lots of nourishment. Will help out with immune issues, digestive issues. It's got probiotics, vitamin D, all the important stuff here. So thank you guys for your time. I really appreciate it. My name is Dr. Adam Davis.